This Week with Bob Mueller on News 2.
This week,
The United States Senate, I hope some are listening, should immediately pass the two House-passed bills that close loopholes in the background check system.
another mass shooting tragedy leads to renewed calls for stricter gun laws, and the president is leading the charge.
Is focused on the protection and the expansion, really, of Second Amendment rights and liberties.
Gun laws are about to be weakened as state lawmakers are on the verge of approving permitless carry in Tennessee.
Vote against this law.
The mother of one of the victims of the 2018 Waffle House shooting is urging Governor Lee to drop his support of so-called constitutional carry.
This situation that we are seeing at the border, this is President Biden's immigration policy.
Senator Marsha Blackburn heads to the U.S.-Mexico border and says the Biden administration is to blame for the migrant surge there. More in our This Week cover story. Hello again and welcome to another edition of This Week. A surge of migrants at the U.S. southern border is turning into a humanitarian crisis. Tennessee Republican Senator Marsha Blackburn visited the border to see for herself. More in our This Week cover story. But first, a look at the other political headlines of the week. This week, Governor Bill Lee was part of a Zoom meeting with the Tennessee chapter of the National Rifle Association to confirm his support and likely passage next week of the so-called constitutional carry bill, allowing the carrying of firearms concealed or in the open without a permit.
The bill is focused on the protection and the expansion, really, of Second Amendment rights and liberties. But it's also really a part of what is, for me, a public safety agenda. That includes, criminal justice reform. It includes support for law enforcement. And this particular piece of legislation not only protects the Second Amendment, but it actually creates a safer environment in our state. Stiffens penalties for those that break the law.
The governor said for him it's about protecting a constitutional right, not to be infringed on by gun registration or carry permit requirements.
Fundamentally, this is about protecting what at the birth of our nation our founding fathers established in the Constitution. That Constitution is the framework by which we should operate as a nation and as a state. And the Second Amendment in particular in that framework is very clear and it's very concise. It is very simple what the founders had in mind. And it was to allow the citizenry to be protected against a tyrannical government.
The mass shooting in Boulder, Colorado that left 10 dead has again placed gun violence top of mind for many. That includes the mother of Aquila da Silva. The young aspiring Nashville musician was one of 4 people killed in the 2018 Antioch Waffle House shooting. Shondell Brooks has been a vocal advocate for stricter gun laws since her son's death. She joined faith-based leaders in Tennessee who are urging the governor to pull his support for permitless carry of guns. We know that several law enforcement agencies have come out against permitless carry. Now, more than 500 faith-based leaders and families of gun violence victims are speaking up. State Capitol Newsroom reporter Gerald Harris has more on the outcry.
Shock, disbelief, why my family, pain.
Shondell Brooks describing what so many families are feeling today after recent mass shootings in Boulder, Colorado and Atlanta, Georgia.
Anger.
Brooks knows it all too well. Her son, Aquila da Silva, was killed in a 2018 mass shooting at a Waffle House in Antioch. Brooks is now speaking out against Governor Bill Lee's permitless carry bill.
Receiving a call that your child was shot and learning that he didn't make it was devastating. Looking at his cold, motionless body in a box was painful and traumatic.
The legislation being pushed by Lee will allow anyone 21 and over to conceal or open carry guns. She says more guns without proper vetting is not the solution.
Please, please listen to law enforcement and public safety experts, families that are personally affected by such horrific and traumatic act of violence, and vote against this law.
Governor Bill Lee making his case during a discussion with the NRA, which ironically was taking place as news of Monday's mass shooting in Boulder, Colorado was breaking.
The ability for a law-abiding citizen to carry a firearm without a permit is not connected to violent crimes committed with guns. And a lot of people seem to put those in the same bucket.
Members of the faith community are also speaking out.
We want to be sure that people handle firearms safely, that they are trained, and that they go through the protective measures to ensure that we don't have to see the type of mass shooting our nation has become accustomed to.
President Joe Biden also weighed in on the gun violence issue, saying he wants tougher background checks and to take moves to ban assault weapons.
The Senate should immediately pass, let me say it again, the United States Senate, I hope some are listening, should immediately pass the 2 House-passed bills that close loopholes in the background check system. These are bills that receive votes of both Republicans and Democrats in the House. This is not and should not be a partisan issue. This is an American issue. It will save lives, American lives, and we have to act. We should also ban assault weapons in the process.
The president called on the House and Senate to take action on what he calls common sense gun control measures. Now to our This Week cover story. Republican lawmakers have been making pilgrimages to the U.S.-Mexico border as a seasonal surge of immigrants grows to record numbers, pointing the fingers of blame at the Biden administration. This week, Tennessee U.S. Senator Marsha Blackburn made the trip, reaching the same conclusion. Tennessee Republican Senator Marsha Blackburn spent time in Arizona at the U.S.-Mexico border with sheriffs from border counties to see firsthand the recent surge of immigrants.
This situation that we are seeing at the border, this is President Biden's immigration policy. And this is his border policy because he is responsible for these open borders and what people are dealing with on the southern border. It really is a crisis.
A crisis, she says, that impacts every state.
We know because of the impact of the cartels, we know because of the impact of the drug trafficking, the sex trafficking, human trafficking, and the gangs. Until these borders are secure, every town will be a border town, every state a border state.
Senator Blackburn says the surge is because of signals and decisions from the White House.
They are coming because, in their opinion, they heard the president say that the border was going to be open. We know that's not an immigration policy that can be sustained, but it was very insightful. I'm grateful for the opportunity to have had the day to be down there and to firsthand go see the walls, see the holes in the wall, see where the construction has stopped.
But illegal immigration surged when President Trump started construction of the border wall.
People were fearful that when the border wall was resurrected, they wouldn't be able to get in. So yes, during that summer, you saw the numbers go up, but then what happened? The numbers came back down.
Senator Blackburn says she wants a designee to focus on the Northern Triangle countries on immigration issues, and
we should continue building that wall and make certain that you plug the holes and the gaps that are in that wall. Law enforcement and our Border Patrol have told us having a wall, a physical wall, helps them. The second thing they need is more intel and surveillance. The cartels are very sophisticated. They have established outposts and lookouts on the tops of these mountains, and they monitor our Border Patrol and local law enforcement in those counties. The third thing is put back in place the Remain in Mexico policy.
Stay with us. This week continues in a moment. Welcome back to This Week. On the COVID-19 front, the end of vaccination phases is near. All Tennesseans will be eligible by April 5th, and yet vaccine hesitancy remains a problem. More now from the State Health Commissioner, Dr. Lisa Piercy.
You know, we've had vaccine available here in the state for about 3 months now, but we have been going pretty steadily through our phases and through our prioritization. But we are getting very close to a point where we can open it up to everyone, and that's the news we have for you today. Immediately, technically as of last Thursday, March 18th, all Tennesseans age 55 plus and all of those in phase 2 of our vaccine plan are now eligible. So phase 2, that's both 2A and 2B, encompasses what we call critical infrastructure. There's a long list of those, and so I would refer you back to the plan, which is posted on our website, to get you through all of those categories. But essentially, think of things like public transit and commercial food production, and other people in logistics, and those things that are critical to the infrastructure of our society. Again, long list, check the plan on our website, but all Tennesseans age 55 plus and in phase 2 are now immediately eligible for vaccine. All Tennesseans age 16 plus will be eligible in Tennessee to get a vaccine no later than April 5th. Now, I said something important there that I wanted to make sure you caught. That is no later than April 5th. There are some counties where all residents of all ages are now eligible in that county. That's really good news because we want uptake to be as high as possible, and we want to remove all of the barriers that we can. We are expecting a total of 311,000 doses in the state this week. Now, that does encompass both first doses and second doses. And then next week, we expect about a 30% bump in first doses. So I'm throwing out a lot of numbers here, but that will take our total next week up to over 350,000 doses. Now, what changed? You'll remember we had to scale back, or the federal government actually scaled back on our Johnson & Johnson allocation for the last couple of 3 weeks, and that is resuming next week. We expect anywhere between 50 and 60,000 doses of Johnson & Johnson beginning next week, the week of the 29th. And so that will take our total doses in the state for next week up to in excess of 350,000. We don't constrain people by county lines. When supply was lower and the vaccine was a lot harder to come by, there was a lot of talk about vaccine tourism and people driving to different counties. And while we never prohibited that, it really wasn't expressly encouraged. That's less of an issue now. And so if people are willing and able to drive to different counties to get a dose, there are no restrictions against that. But no worries if there are people that aren't able to do that, and we understand that there are people with barriers to transportation or don't have the ability to drive or go across county lines. It's not a problem. We are going to supply your county very soon. All of the counties are currently getting their population-based allocation, and for the counties that are not able to exhaust those county allocations, those are being redirected to counties where there's more demand. So I'm really glad to bring that announcement to you today. Like I said, I hope we don't have to talk about vaccine phasing anymore, because we're finally at a point where supply is opening up enough where we can make all Tennesseans eligible. So once again, all Tennesseans age 16 plus will be eligible to receive a vaccine in Tennessee no later than 2 weeks from today, which is April 5th. And before I conclude, I want to brag on my friends at Metro Nashville Public Health Department. As you know, they had an enormous event on Saturday, March 20th, where they vaccinated, at last count, 10,107 individuals at Nissan Stadium. And I don't have official confirmation, but I believe that is the largest single site vaccination event in Tennessee history. And so I'm really proud of Dr. Gil Wright and Dr. Alex Jahangir and the hundreds of volunteers and staff, as well as the city and county metro leadership. They have done an excellent job. And it just so happened it was on the first day of spring, which was a great symbolism of a new awakening and a new dawn. And I'm really glad that we've gotten that behind us. One of the reasons that we are pushing forward on expanding eligibility is because our uptake has been lower than expected, particularly in our rural areas. And so that's to be expected. We anticipated some degree of that. Quite frankly, we did not anticipate to have such a low uptake in some of our areas. We understand that there's vaccine hesitancy, and we also know, because we've already seen it, that sometimes people just need a little bit longer to get used to the idea. They see their friends and family get vaccinated and then they come around. That's understandable. But while we are having lower uptake levels, that means we have an excess supply. And you've heard me say for months now, the last thing I want is any vaccine sitting on a shelf somewhere. So we want to get that out to the people who want it, and create all kinds of open access and remove any barriers that we can.
Stay with us. This Week continues in a moment. It's been weeks since Governor Bill Lee took questions from reporters. That streak ended this week as the governor discussed opening up of COVID vaccines soon to all Tennesseans, when the Nation Bedford Forest bust will be removed from the state capitol, and more.
Well, President Biden has made a request of all states to make vaccine available to all Americans by May 1st, and we wanted to commit to that, but we actually wanted to improve on that. We took we looked at, on balance, of the requests for vaccine across the state, the supplies that we believe are coming in the next several weeks, and we determined that we believe the supply and demand will provide us with the opportunity to give it to everyone in the state. Well, you know, there are a lot of folks in our state that actually contracted COVID. There may be we don't know who is going to take the vaccine or not. Boy, we're encouraging Tennesseans of every stripe and color and age and every Tennessean to take opportunity of this vaccine. We're making it available in every community, working really hard to make sure we do that. But combined with the number of folks that will receive a vaccine and those that have contracted the virus and have a level of immunity that is yet to be determined how long that immunity lasts or what level it really is, we certainly hope that a herd immunity, or that we are able to approach it through that. But I think it's important to remember the best way that's going to happen is through immunization, through vaccination. And that's why we're trying to make it available to every Tennessean. The Historical Commission voted on that about maybe 10 days ago. I don't remember the date. There is a 120-day period following that vote that is a part of that process. So there's a process outlined in statute for that. And whatever that period occurs, then there is a process that includes the building commission, and I don't know the steps after that, but that process will be followed through. We followed a process, which is the right way to do this. We don't rip down or remove or tear down without a process. We follow a process. We brought it before a Capitol Commission. We followed that process and the timing associated with that. We brought it before a Historical Commission, and we will follow the process as outlined in statute for any changes that occur in the Capitol. And I think that's the right way to do it. It is an initiative that pulls together these partners and others to work on a collaboration so that we increase the number of community organizations and churches that are involved in this effort so that we increase the awareness of Tennesseans all across the state of the needs for the foster care and adoption system, that we increase our ability to provide services for those families that want to be engaged. So there's additional training associated with this. There's additional networking and supports for families. It really is an increased collaborative effort that pulls together and brings to the table stakeholders who are experts in the field so that we can better serve families who might have an interest in adoption and foster care.
Stay with us. This Week continues in a moment. We do want to thank you for spending part of your weekend with us. That will do it for another edition of This Week. We hope to see you back here next weekend for another edition of This Week. In the meantime, you have a great week.